Hello, good morning. I am Dr. Ahmed. I am one of the surgical doctors here. May I confirm your name and age, please?
Okay, my name is Edward. My age is 25. Daron.
Nice to meet you, Mr. Edward. Today I'm here to ask you some questions regarding your condition and taking some notes. Is that okay with you?
Yeah, it's okay.
How can I help you today?
I have a fits. I have a fits.
I'm so sorry to hear that, Mr. Edward. This must be frustrating. Could you tell me more about this?
Okay, I have abnormal movement of my left arm while I'm playing PlayStation with my friend.
Could you tell me when did it start?
It start. It's about 24 hours.
24 hours. How did you feel immediately before the episode, Mr. Edward? Do you notice anything different?
Yes, I see a halo.
Do you experience any unpleasant smell or unusual sound or any headaches?
No.
Do you lose your conscious, Mr. Edward?
No.
For how long did the episode last?
It take about 10 minutes.
I'm so sorry to hear that, Mr. Edward. Did anyone witness the episode?
Yes, my friend. He playing with me PlayStation, as I said to you.
Do you experience any arm or leg weakness?
Yeah. After the episode, or it's before
during the episode? During the episode.
No, I don't experience anything.
Do you experience any eye blinking, excessive eye blinking, or eye deviation?
Yes.
Do you experience? Do you bite your tongue?
No.
Do you experience lip smacking?
No.
Do you wet yourself, Mr. Edward?
No.
Okay, Mr. Edward, let's move on and ask you, how did you feel immediately after the episode?
Okay, I feel tiredness, generalized tiredness.
Did you gain your consciousness immediately?
Yes.
Did you?
I don't lose my consciousness.
I'm so sorry for this question. Do you experience arm or leg weakness?
No.
Do you experience arm or leg numbness?
I experience my fittings arm has a numbness. Okay.
Okay, Mr. Edward. Do you have any speech problem?
No speech problem.
Any vision disturbance?
No.
Mr. Edward, do you have any previous similar episodes?
No.
No? Do you have okay. Mr. Edward, before I go any further, okay, Mr. Edward, do you notice any unintentional weight loss?
Yes.
How many kilos?
10 kilos.
For how long?
About in the last 6 months.
Okay. Do you have any weakness in your arm or legs?
You asked me this question.
No, I'm asking about in the past.
No.
Do you have any vomiting?
No. Yes, I have a vomiting.
You have vomiting. Okay. Mr. Edward, do you experience any trauma recently?
No.
Mr. Edward, do you have any fever?
No.
Do you feel your neck is stiff?
No.
Do you have any skin rash?
No.
Do the light bother you, Mr. Edward?
No.
Okay, Mr. Edward, before I go any further, could I ask you, what do you think the cause is?
I'm afraid of that I have a cancer.
I understand your worries. What do you hope from us to do?
To find out.
What's your most concern about?
I'm concerned about cancer.
I understand. Time's up.
Okay, present your case.
Okay, I took a clinical history from Mr. Edward, who is 25 years old. Presented to us with left arm's seizures lasting for 10 minutes for the last 24 hours. Also, he lost about 10 kilos, and he has no signs of infection. So my main differential diagnosis will be brain tumor. Also, I will consider meningitis, and epilepsy, general seizure disorder, epilepsy, and also I will consider electrolyte disturbance, hypoglycemia, and alcohol withdrawal seizures.
Okay, and how would you investigate this patient?
Firstly, I will start by doing a neurological examination. Then I will order blood investigation like CBC and electrolytes, ABG, and also I will consider regarding imaging. I will go for CT brain and MRI to the brain, and also echo encephalogram, EEG. Also, I will go for PET CT and CT to exclude the malignancy.
Okay, that's fine. And how are you going to treat this patient if this patient is seizing?
Ongoing seizing.
Yeah.
Firstly, I will move the patient to the safe place. Then I will position him laterally. Then I will observe the seizures and the duration. Then I will prepare for ABC assessment.
Okay.
Regarding post-ictal.
Okay.
Regarding for ictal, I will assess ABCs and vital signs. I will provide him with oxygen and give him
Okay, this
barbiturates.
patient you say that have you consider brain tumor. In that case, what is the main management for the patient? What's the appropriate management?
My main management, I will discuss this patient in a multidisciplinary team and staging him by MRI and CT. Then I will go for debulking surgery.
Okay, that's and what do you think? What is the definition of sensibilities?
What do you think? What
is the definition of sensibilities?
The definition of sensibility is epilepsy, active epilepsy lasting more than 30 minutes.
And how you are going to manage this patient if he is anesthesia epilepticus?
I will assess ABC and give him oxygen and give him barbiturates like alphenytoin and carbamazepine and valproic acid and phenobarbital.
Okay. Thank you for the next station. التايم فريم بتاعك ممتاز، لكن بس محتاج تحرك اب شويه كده، لانه يعني انت هسي you lost some part of the history, and
ايوه
despite that he didn't give you past medical history of Caesar, so he saved a lot of time for you.
صح والله صح. ما عارف الزمن راح وين والله سبحان الله.
What is important note about time? I'm sure that you are knowing the questions, so don't repeat do you have or did you have. Just ask any to save a lot of time. Okay.
اوكي سالت من الكونشن
الانفكشن دي ايوه طيب واصل معلش.
الويكنس كويس معاك، الديوريشن برضه ظبطتها كويس معاك، بودي شيكينج ولا بتاع دي هو انه هو البودي اور بارت او فضيت ويت يور سيلف، ما تقول سويل يور سيلف برضه.
انا عجباني ويت يور سيلف مالك انت.
ما هي ما اثنين الاثنين
Wait or soil yourself. Okay.
بيت اور سويل يور سيلف. هنا اسمه شنو؟ ما دي ستول وده يورينيشن صح يا ابراهيم؟
Did you wait or soil yourself?
اي
That's a combination.
combination. طيب كويس. after Caesar any weakness هو بتاعي هو سألت منها بعد دي الحتة اللي اتكررت صح؟
لا هنا ما تكررت، هنا ده مكانها الحقيقي يعني.
طيب في الاناليسيس طيب ما مشكلة، انا اقعدك شوية يا احمد. هو before و during و after. Could you just repeat the question about what happened during the Caesar? Could you ask him again?
How did you feel immediately before this episode?
During.
انت داير during.
Yeah.
Did you lose your conscious?
Yeah.
No.
Did anyone witness the episode?
No.
For how long this episode last?
10 minutes. طيب after?
After, how did you feel immediately after the episode?
I feel fatigued and exhausted.
Do you have any weakness in your arms or legs?
Again?
Did you have any weakness in your arms or legs?
No.
Did you have any speech problem or eye problem?
Excellent. انت كان في فترة في الهيستوري كان لما انت تسأل من الحاجة دي بتسأل ب do you بدل
did دي حاجة في الباص.
دي صيغة الباص صحيح. يلا بمناسبة الويكنس ما سألته من did he describe it? How he describe it?
انت قلت لي ما فقدت الكونشس بتاعك، انا describe داير بوش انت مش واعي بالحاصل.
ما كبير قلنا ممكن تقولها عشان تشيك ليست.
لا تشيك ليست ما تشيك ليست قال لك ويتنس بس، لان كان ما تتمادى تقول له describe it. ما describe it انت ده اللي كنت واعي ده مالك. صاحب الوجع.
انا قلت احتمال يكون هم مثلا.
لا انا عملت لها سكيب قاصد، ما هو عيان واعي.
ممتاز.
اوكي كويس.
طيب
لكن كويس يا منير توقعتني في تريكات الليله.
هو في تريك ثاني وقعوا فيك اللي هو he told you asked me this question. Whenever he told you that you asked me this question, you have to answer him or start by apologizing. Sorry for that.
قلت له I'm so sorry to repeat this question. I'm so sorry for that ولا ما حابب شيء كده.
You told him no. You said so sorry about the question. Did you gain your consciousness? You say so sorry for that. But when he asked you asked me this question. You say no. This is a different question. Blah blah blah.
ده في الويكنس البرين تيومر.
So yes. So just start by I'm sorry for that. Even if you repeat it really, I'm sorry for that. I'm just want to be more clear about it. No problem. Just try to show some empathy or to be polite with the patient when he asks you ask about this.
I'm just want to be more clear, صح?
Yeah. Or I'm sorry for that. Just make sure I understand your topic. um, excellent في الكانسر. He asked him about his expectation. He said cancer. You say yes, I understand that. I think when he tells you about cancer, I'm going to die or something like that, you have to show more empathy in this. I
I'm
know
so
no
sorry.
problem if you take some time. Yeah, you don't have to say I'm so sorry for it. You can just say, for example, don't worry, it's early to think about something like that or something, because you ask him about his expectation.
يلا الاكسبكتيشن المسألة عنه.
لا الثلاثة يا زول.
He asks you about what do you think the cause is, what is your concern, and what is your expectation, I think.
هاي الثلاثة سألته منه.
In his concern, you say that you have cancer. Concern also.
ما أعرف، أنا حسيت إنه فينا
cancer. I'm not sure says about
أنا قدمت الهوب expectations ورجعت للكونسين في الآخر. أنا السؤال اللي في النص خليته في الآخر بس كل اللي حصل يعني.
الايديا سالتني جاهزة.
Excellent. Any comment أحمد in the history؟
هذا شركة ما في حاجة ثانية نضاف. أصلا الباص ميديكال هيستوري أصلا ما حصلوا صح؟
other medical condition no.
ما حصل هذا بس كويس. أنا بس كان فيها بوزيتيف يا هو البلد جلوكوز والإبيليبسي.
Excellent. Fantastic. في السمري in summary I think you missed just it's important to speak about the consciousness when you speak about the seizure. You see the duration that puts focal in the right or left hand. You have to mention.
أنا قلت في الليفت هاند. أنا قلت هي في الليفت هاند وقلت هي اسمه شنو؟ قلت هي لاستنج فور كده ولها 24 ساعة. عرفتها بس يا هو.
Yes, it's better to speak about the
غايته من الله ادانا استراتيجية حلوة كده يعني التعامل بها في الاكسترا، وقال دي مفيدة يعني.
في
عموما قال انت بتذكر اسم العيان والعمر بتاعه والمين كومبلين بتاعك، بتحاول تدي فيه 3 معلومات كده او 4 بالكثير، اي حاجه كده. بعدين تو سبورت يور دايجنوزيس بالفايندنج التحت بالاسوسيشنز. يعني مثلا انت لو اصلا ماشي مع كانسر فبتقول انه هو فقد وزنه عنده لوس اوف هابيتايت، او المهم بتدعم حاجتك دي بمعلومتين 3. عرفتها؟ في كيس انك انت عملت دايجنوز لحاجه غير المالجنسي، تراي تو اكسكلود المالجنسي، بعدين بس تقول سو ماي مين ديفرنشال كده.
ممتاز.
ايوه بس بالظبط.
يعني هسه هنا انت عندك حاجه مهمه، اذا كان نون كيس او في بيبسي بتخط له فوق. اسمه شنو؟ مستر اكس كنت كده نون كيس او في البيبسي فور how many
كنت في البدايه
he's on which medication, then you start presenting with, then you describe the seizure. تمام. فبس دي الحاجه المهمه في السمر بتاع انه ده داخل السيزر. بعد ذاك الوقت اصلا هتدخل لانه اصلا البيشنت انت خدتيه كبرين تيومر. فا اكسلنت والله. هنا انت كنت تتكلم ايكو الكترو انسفالوجرام، انت قصدك الاي اي جي صح؟
الاي اي جي
الكترو انسفالوجرام.
الكترو معلش انا قلت ايكو.
اي otherwise excellent والله.
كويس.